Prior to getting the patient in the wheelchair, you want to make sure the wheelchair is equipped with working equipment as well as the patient being fitted to the appropriate accommodations as seen in skills 12 and 13. Majorly, you want to be keeping constant communication with your patient during accelerating, stopping, turning, anytime you're doing a new action. You want to have both hands firmly on the handles at all times and avoid sudden accelerations or stops. When walking with a patient, try to walk on the right side of the hallway to avoid during times of high traffic. When you're turning, you want to be able to use mirrors in the hallway to see around corners. When turning, you want to hold with one hand steady and push the other handle, completing the turn, getting on your way. When approaching push door, it's easiest to approach backwards. Placing the patient on the hinge side, angled towards the hinge side as well. Back through the door, opening it wide enough for the patient to get through, and pull the patient all the way through the door. Keeping your body between the door and the patient to ensure that his feet don't get caught. You can either approach a pull door, either forward or backwards. When approaching forward, get the patient on the right side of the door, facing the hinge side. Open the door wide enough for the patient to fit through using your left hand or foot. Get your foot in the door, protecting the patient from the door, closing door. Push patient straight through. When approaching pull doors backwards, again place the patient on the non-hinge side of the door, angled towards the non-hinge side. Pull the door open, again propping it open with your foot. Pull the patient straight through backwards, ensuring that the feet are protected as you're closing the door. Enter an elevator going either forward or backwards. During the forward approach, press the button. Move the patient forward, prop the back wheels up, enter the elevator, enter down, close. Do not attempt to turn around in the elevator. When backing out of the elevator, make sure you come back, make sure there are no obstructions in the hallway, back the patient out, making sure that their feet are clear of the closing doors, and you're good to go. When backing into the elevator, make sure the elevator is first clear. Back the patient straight in. Make sure the legs have cleared the elevator door. And upon exit, elevate the patient back slightly, get the caster wheels over, and then exit the elevator, making sure there's no obstructions in the hallway. When going down an incline, you have a couple options. You can prop the patient up onto the back wheels, supporting with your back, and slowly lower them down the ramp. Or you could also simply go backwards, all four wheels, using your back to support, and drop them down the ramp slowly. One other thing, when going up the ramp, you should never have the patient facing backwards down the ramp. So if you're heading up this way, never have the patient face this way down the ramp. It's not a good procedure. When going up a ramp, there's a few options. You can walk with all four wheels straight up the ramp if it's not too steep. You could also tilt the patient onto the back wheels and walk up supporting using your hip. You can lower them down here now. If the ramp is very steep, sometimes it's easier to zigzag, so going from side to side on the ramp, helping support all the way up.